Hello, excuse me, nurse, we need someone.
What's the matter?
She's just been breathing really fast and
Okay.
really deep, and she's confused. We don't know what's going on. We need help.
Here, we're gonna take care of her, okay? Just
What we see here is a classic case of diabetic ketoacidosis. DKA is a serious complication of diabetes that occurs when your body produces high levels of blood acids called ketones due to a lack of insulin in the body. Without enough insulin, your body begins to break down fat as fuel. This process produces a buildup of acids in the bloodstream called ketones, eventually leading to diabetic ketoacidosis if untreated. Risk factors include being young, having a lower body mass index, and being newly diagnosed with type 1 diabetes mellitus. Signs and symptoms include Kussmaul respirations, presenting as a rapid and labor-intensive breathing pattern, abdominal pain, confusion, and the breath smelling of a fruity odor resulting from exhaled acetone. Other symptoms include fever, dry skin, hypotension, excessive thirst, and a rapid and weak pulse and malaise.
Hi, my name is Arlene. I'll be your nurse for today. Can you tell me your name?
My name
Liv, her name's Liv.
Okay. Can you let me know what's going on today? Who are you? I'm sorry.
I'm her sister.
Sister. Okay, cool. So what's going on here?
She's been confused, really confused. She says she's in Africa. She's asking about her grandma. She's been dead for 5 years.
Oh, okay.
She can barely breathe.
Okay.
I'm really
She's thirsty, confused, very confused.
Okay. Does she have a history of anything?
They diagnosed her with type 1 diabetes.
Type 1 diabetes. Okay. Well, let's get a quick set of vitals on you real quick, and I'm going to check your blood sugar real quick just to make sure everything's okay. Kevin, can you get some vital signs?
Absolutely, I can do that. Alright, what's going on here?
Hello, Dr. Dimitri. Here we have Miss Liv. She's a 21-year-old female who came into the ER with her sister. She's came in with some deep and rapid respirations, confusion, and has a breath that has fruity odor to it. Her vital signs were 136, BP 96/70, respiration 32, O2 at 94, and a temperature of 100.2. She has a recent diagnosis of type 1 diabetes, and she has no other comorbidities at this time.
What was her finger state?
It was 6:53.
Okay, I need ABGs and a Campanile stat.
Okay.
Because it sounds like she's experiencing DKA.
Okay.
Insulin decreases the levels in the blood by redistributing it into the cells. Did you know, in persons with DKA specifically, death in the initial phase of resuscitation is usually related to hyperkalemia? Other electrolytes to monitor include phosphate and magnesium because they can decrease in DKA. In DKA, we can expect that the plasma glucose level will be greater than 250, the arterial pH will be less than 7.0 in severe cases, and the serum bicarbonate will be less than 10 in severe cases with the presence of ketones in the urine. The patient's mental status can also result in a coma if the DKA is left untreated.
Hi, Dr. Dimitri. This is Arlene calling about Miss Liv in room 204. I was just calling to let you know that I got her labs back. She has a glucose level of 653, an arterial pH of 6.89, a serum bicarbonate of 9, urine is positive for ketones, and a potassium of 5.3. What would you like for me to do at this time?
The priority interventions for DKA include replacing fluid loss with normal saline, which will correct the hypotension, decreasing the serum blood glucose with insulin via IV, reversing acidosis, and treating the underlying condition, if any, and correcting any electrolyte imbalances. It is important for the nurse to monitor the vital signs and electrolytes very closely.
Okay, so start her on a bolus rapid normal saline solution, 1 liter, and a continuous infusion of normal saline at 500 milliliters per hour for 3 hours stat. Give an IV loading dose regular insulin at 0.1 units per kilogram. And I need you to monitor the vitals every 30 minutes, electrolytes, especially the potassium, every 2 hours, and glucose needs to be monitored every hour.
It is also very important that each patient has knowledge of diabetes and the complications of diabetes.
All right, Miss Liv, how are you feeling today?
Good. I feel better after y'all hooked me up. to
Okay,
this
good.
thing.
I'm glad. Do you know where you're at now?
Yes, at Islanders Regional Hospital.
Perfect. Okay. So there's just some things I want to go over with you before we continue on and before you go home.
Okay.
So I want to make sure that you know how to monitor your blood glucose levels. Making sure that you know that you have to do it before meals, before you exercise, before snacks, and before bedtimes. Okay.
Okay.
Make sure that you're eating that healthy meals, so things of like complex carbs, fiber, proteins, veggies, and we can get the nutritionist in here if you want more in-depth stuff, okay?
Okay.
Limiting amounts of hearty, healthy fats and sweets.
Oh man.
I'm so sorry. Most importantly also is if you get sick, making sure that the management is up a little bit more. So checking your blood glucose levels more often than you usually do, because that can cause your sugar to spike a little bit higher, okay?
Okay.
Making sure that your insulin regimen is up to date and that you're complying with all of that, okay?
Okay. And this will prevent me from coming back here.
Exactly. And of course I will give you an information with stuff that you can take home if you still have any questions.
Okay. Thank you.
You're welcome.
When I'm with my clique, we know how to party. How to party, yeah. We know how to party. How to party, yeah. We know how to party. How to party, yeah. We know how to party. How to party, yeah.
Revisited by both the patient and the healthcare professional.
Okay, Grandma.
She's already said. Ketoacidosis if untreated. Risk factors.
Okay. You don't. That's it.
Oh, see you guys. End it. Electrolytes to monitor include fat, phosphate, and magnesium. 1. Insulin decreases potassium levels in
What was the thing? Oh.
Insulin decreases levels in the blood by redistributing.
Okay, now